this is providing denture care. Hello, Kristen. My name is Marie. I'm going to be your CNA for today. I'm going to be taking your dentures out and clean them up for you today. Okay. All right. Go over here and wash my hands. Provide privacy because a lot of, especially ladies, don't like anybody to see them without their teeth in. So make sure you provide that privacy. I'm going to raise the head of the bed. Ideally, it's best if the patient can take her own dentures out, but if she can't, then I'm going to help her. Okay. Assist the patient to the bathroom if you can, but you know, we could do it right here in the bed. We're going to put on clean gloves before we handle the dentures. Because like I said, they're going to be slimy and yucky and probably have food and stuff all over them. So you want to make sure you have the gloves on. So if she can't take them out, put them up, hold them one in each hand for me. So I can, yeah, oops, trip me on it. So I'm going to take the bottom ones out first because that's the smaller one. So I'm going to, there's a little lip right there. You're going to kind of get your fingernail underneath there and kind of pull up, and I'm going to twist it sideways and pull out of her mouth. Always have your denture cup right there with you, okay? And then the top ones, there's going to be more suction, so you're going to pull down and sideways and out, okay? And again, all slimy and gross looking, okay? All right, so I'm taking this over to the sink. I'm going to have a place right here that I can put my clean stuff. I'm going to my toothbrush for my dentures. Okay. I'm going to line the sink with paper towels. All right. Why do you think I'm lining the sink with paper towels?
So it doesn't get.
So it doesn't get what? Well, I'm lining the sink with paper towels because I don't want to, if I drop it in the sink, it's not going to break. Hopefully it won't break, okay? And I'm going to run the water. Remember what kind of water we have? Warm water, not hot. It'll warm the dentures. All right, I'm going to rinse them off first because they're going to be gross and yucky. Put that up there. No, I don't want to do that, sorry. Put it back in the cup. Rinse them off, put it back in the cup. Okay, I'm going to take it, my toothbrush. Oops. Toothpaste on here. Always maintain clean technique with the toothbrush. Hold the denture in your hand like that so that you have control of it. Let's just start brushing, just like your own teeth, okay? Jiggle, jiggle, sweep. Don't really have to do that much with this, but just make sure you're getting all the crap out from in between the teeth. That's a technical term, just saying. Alright, rinse them off. Now I'm going to place my clean denture on this clean paper towel here while I brush the other denture. Again, same principle, brushing all the surfaces. Rinsing. Lastly, I'm going to rinse the cup and the lid. I'm going to go ahead and put the dentures back in here. If I'm going to be storing them in her bedside stand, like she's not going to put them back in, I'm going to go ahead and put water in there, but she's going to put them back in. Okay? Put her denture, I'll shut this water off. You didn't need anything, right? Alright, so I'm going to with these same gloves, go ahead and take that paper towel out. Okay. Now I'm going to take off my gloves. Wash my hands after I take off my gloves. And since I'm going to be putting them back in her mouth, I'm going to put gloves on again. And she likes to have some denture cream in her teeth. So we're going to pretend this is denture cream. All right. Which one's going first? So I'm going to bring this over to her bed. All right. So you say you want some denture cream, huh? And I'm just going to pretend I'm putting this on, okay? And this isn't really denture cream, but we're pretending it is, okay? All right, hit it sideways, and then up, and then push, like that. You won't hear that whenever you push it in. You might hear it when you push, taking them out, okay? And then, oh shoot, I forgot something. Back up. Before I put her dentures back in her mouth, I am going to offer her, just one I can pretend with, I'm going to offer her some mouthwash to rinse out her mouth with. Okay. Just pretend. Yeah. Okay. Before I stick her teeth back in. If she's able to do mouthwash. If she's not able to do mouthwash, then I would use a swab and wipe out her mouth. Okay. Before I put her dentures in, because she might have food and all kinds of stuff still in there, okay? And you go to stick these dentures in, and if there's food in her mouth, it's going to hurt, you know, whenever it's going to give her sores and everything else if there's food in her mouth still, whenever you're putting the dentures back in. All right, now I'm going to put the denture cream on here, stick them in her mouth, sideways, in and up. More denture cream. Sideways, in, and down. Okay? Slip back in here. Take off my gloves. Wash my hands. Are you doing okay? Is there anything else I can do for you?
Nope.
Okay. I'm gonna make sure she has her call bell. The bed's low, locked. And there's nothing really to report and record, but unless there was something abnormal, like when I went to put her teeth back in her mouth, maybe I noticed that she had a sore or something like that, which happens. So you need to really pay attention to that. Make sure you're doing that mouth care before you stick those dentures back in. Another way to clean out the mouth, and you guys will learn this whenever you watch the video tomorrow about the mouth care without a battle. They take a little, like a little gauze pad, and they wet it either with some mouthwash or even just water, and you stick your